how well do you guys treat your oral hygiene? Specifically, how do you guys treat your teeth very well? Because it's actually very, very important for you to make sure that you have not just pearly whites, but pearly whites which are also well
aligned.
Well aligned, I guess, exactly.
Well aligned. And of course, especially for us, where we're always on camera, that is something that we have to look to. Wait, I want to talk about this, right? We're talking about this. How often do you see your dentist?
How often do I see my dentist? I see my dentist once in 6 months.
Oh, you do?
Because that's what I tell the camera. Exactly.
I think my past dental appointment was probably a year ago, which is quite bad. Okay, you should definitely see your dentist every 6 months. And I think before that 1 year appointment was probably when I was back in high school.
Right. So enough about our own personal oral hygiene. We do have a doctor in the house who's going to be talking to us about braces and aligners. What are these things actually? If you guys are not really known about all this, hence why we do have her. We have Dr. PRAVEEN GILL, orthodontist, a specialist from DentalPro, to talk about this wonderful things. Good morning, doctor. How are you?
Doctor, you look as lovely as ever, and pretty sure more lovely than me or here.
Thank you so much.
Well, if I'm lovelier than she is, then something's wrong somewhere. But I have to say from the get-go, your teeth looks fantastic.
Thank you. It has to be, since I'm in that profession, isn't it? It's a pleasure to be here. Thank you for having me today.
Thank you, doctor. Thank you so much. And of course, talking about dental hygiene and talking about our teeth alignment and all that, we have to go in straight. You know, what are the major differences? Because we're talking about braces here, talking about aligners, like, what are the major differences?
So basically there are two different approaches to correct and straighten teeth. So I'll speak a little bit about each of them so that you have an idea before we talk about the differences. So the first would be braces, and there are three different types under the braces category. So we've got metal braces that has been around for the longest. It's been
ages,
around
right?
ages. It's been around for decades.
Which we're more familiar with.
Yes, that's right. That's the one you're more familiar with. And so you've got metal braces, and then the second one would be ceramic braces. So ceramic braces are similar to metal braces, but they're more aesthetic. So they are, if you have a look, they are white in color and they're clear. They're still visible. So if you're talking to someone with ceramic braces, you can still see that they have them on, but you can't really tell on photos and videos. And the third one would be lingual braces. So lingual braces are placed on the inside of the teeth, and they're considered the most invisible option, you know, because you can't see them at all. It might be a little bit tricky in terms of talking with them on because your tongue touches it, so that's not favored by some patients. Then you have a different group, which are aligners. So I'll just show you what it looks like here. So these are braces. Yes, we've got teeth in the house. Of course, so we've got metal braces that are the bottom ones, and then you've got ceramic braces. You can have a look at these. So yeah, and then
showing that to you guys here.
Yes, and so we also have aligners. So aligners are fairly new, I would say, compared to braces. They've been around for about 20 years, but very popular, especially of late, because they are not very visible. So when you wear it, it's pretty discreet, and patients like that, you know, because they're able to straighten their teeth without others really having a look at braces on the teeth. So aligners are a product where we scan teeth, and then we use a software. And using the software, we move teeth into the desired position, and then we get a series of aligners like this. And then our patients change them. So they wear them between a week to 2 weeks, and they keep changing them, and it slowly moves the teeth into the corrected position. Yeah, so the major difference firstly would be visibility. So aligners, if you have them on, you can tell from this model that it's not so visible compared to braces, of course.
Yeah, exactly.
And then the second one is that with aligners, you're able to remove them when you're eating and cleaning. So it makes cleaning a lot easier. Have any of you had braces in the past?
No.
No? Okay, all right.
Perfect teeth.
I'm not going to say that. No, I'm not going to admit to that. But one thing I do wanna ask about the aligners. Again, we are very familiar when we talk about the braces over here. As you can see, the metal, and both of these are metal.
The bottom one is metal. The top one is ceramic.
All right, so you got the metal and the ceramic. We are used to this. I mean, like, you know, we've seen kids in school wearing this again since yesteryears. Even when Erin was born, even these things actually exist. But when it comes to aligners, this obviously comes with technology, how far we have come. That makes it much more easier for us to have such corrective procedures in regards to making our teeth, you know, back, pushing it back to how pretty it should be or how standard it should be.
Yes, that's right. So with exactly, technology has come so far, you know, and initially when aligners started off, we could only correct very minor problems with it, but it's been around for 20 years and it has really come a long way. So today we are able to treat a few more complex problems with aligners as well. Of course, there are certain treatment where we can't, I mean, we favor braces over aligners. That does happen as well. So the right person to see would be an orthodontist, a specialist orthodontist, who will be able to guide you as to which would be the best option. So the major differences would be firstly how it looks. And then another one, you'll be able to take it out. So brushing, flossing is much easier when you have fixed braces on. It's not impossible, but it's a bit more difficult for you to maneuver and clean. And of course, it's also what you eat. So when you have braces, you can't eat certain things because if you eat something too hard, for example, your bracket becomes loose, you can't go on with treatment. You have to repair it. Whereas with aligners, you take them out, you can eat whatever you want to eat. But there is a disadvantage when you can remove it a lot. So if you keep taking them out and not wearing them, then what happens is it doesn't work. So for aligners, you actually have to wear it 22 out of 24 hours a day. Yes.
Sleep.
So yes, exactly. Throughout when you're sleeping as well as throughout the day. So you can only take it out when you're eating and cleaning. And if you don't wear it enough, it just doesn't work, you know. So those are the major differences when it comes to these two systems that we have. Yeah.
Talking about the braces and also aligners, I remember when I was back in school because usually wearing braces started
Which was last year, right?
Young, not there yet, not there. Okay, so usually wearing of braces usually start at a very young age, or when you're a bit of a teenager. So I remember when my friends get super excited when they have braces on, they would go for their dental appointment and they would choose their colours for the braces.
Right. Yes.
So it's really, really interesting because like, oh, suddenly you have yellow and then the next one you have black on or something like that. That's the best part about the metal.
It's very exciting. And now with World Cup season, I have all the colours of football teams.
Yep.
Really?
You've got all the different colours. Yes.
With colourful teeth.
Yeah, they request for certain football team colours and
Oh, you know what my colours would be? It would be red and white.
True England supporter.
Definitely. You had a question.
But anyway, we're talking about all this and I just want to know, what is the best age to start using braces? Because I have nieces and nephews as well, which I think they would require braces. But what would be the recommended age to start?
So in the past, most parents would only bring children to come and see me when, you know, they've got all their permanent teeth. So when they're about 12, 13. So traditionally, this was what was thought, you know, that you only see an orthodontist then. But today, there are certain things that we can do at a slightly younger age, around the age of 8 to 10 or 11, which can actually simplify problems. So currently, the recommendation is to actually see an orthodontist once your child turns about 7, because at that age, their permanent teeth start coming through. And sometimes they don't come through in the right position. We can tackle it by doing something very simple, very minor, that can actually reduce treatment later on, or perhaps not even needing certain treatments later on, you know. So that's what the recommendation is now. But yes, you're right. So you find that a lot of patients who come in around the age of 11 to 16, 17, school-going years, because, you know, you find that all their teeth are developing and teeth move a bit more efficiently and better at that age because they're growing rapidly. But because of more aesthetic options such as ceramic braces, lingual braces and aligners, I see a lot more adults coming in today correcting their teeth. And it's fantastic because I always say a healthy, beautiful smile never goes out of style. You know, and there's no age restriction now. The most important is that we're talking about brushing and cleaning and flossing and oral hygiene, and that's so important because if you have healthy bone and gums, there is no age restriction. You can even have, my oldest patient has been someone who is 62 years old.
Wow.
Correcting their teeth. So there really is no limit, you know? Yeah.
I mean, we were living in such, you know, easier times during the MCO because every one of us actually wore masks, so we didn't have to worry much about showing our teeth to the public. But yeah, the reality is, it's not just because of that. It's because of it does give you that confidence. It does give you that boost when you meet up with people, because a lot of people, they tend to shy away because they have that feeling internally that, oh, all right, I don't look nice because of my teeth. I don't want to talk too much because I don't want to show it off.
Yes, that's right.
But my question about the aligners, again, this is something new specifically because, like you said, it's something brand new in comparison to the braces.
Yes.
Does it work as effective as the metal or the ceramic braces as well, aligners?
Yeah, that's a very good question. Actually, to be honest with you, it really depends on the problem that we see. So it is able, so when it started off, like I mentioned earlier, it could only treat quite simple problems, but today it's come a long way. So we can actually treat more complex problems with bites and things like that with aligners. Of course, in the right hands, so because you have different expertise, different people with, it depends on your experience handling a certain product and a certain aligner or brace.
Sure.
But there are limitations. So there are some problems, for example, if a patient comes with a jaw problem, that would not be my favorite treatment of choice, So I would actually lean towards braces because it would move the teeth more efficiently and effectively.
So it's case per case basis?
It is. So that's why it's really important. So, you do have like certain advertisements, talking about, you just take a picture of your teeth, I'll send you a mold kit and we'll send you some aligners. That doesn't work because every case is different.
Sure.
Every bite is different. So we actually have to treat according to the person and its bite, And interestingly, you spoke about MCO. I had a lot of patients come in then because they said, I'm wearing a mask, I might as well get my teeth straightened out.
That is also true. Yeah, exactly. That's the time when they can hide everything else.
Exactly,
Truly,
yes,
yeah.
that's right, yeah.
All right.
And of course, just to add to your previous question, the effect from wearing both the metal braces and as well as the aligners, is it permanent?
So,
the longevity of it?
So I always say, there's a saying that nothing in life is permanent.
Well.
Same goes with braces and aligners and orthodontic treatment. So the thing is, whenever you've corrected something, it can be permanent. That's what we always aim for, but you need to work at it. There is maintenance involved. Beauty requires maintenance, as we all know.
Yep.
So the same with teeth. So once you have your braces or aligners, whichever option you choose, you will need to get retainers. So retainers are fitted on the teeth. They look something like this. So you've got clear retainers.
Okay.
All right, and then you've also got fixed retainers. So fixed retainers are thin wires that are placed on the inside of the teeth, and they actually just hold the teeth together in place and they don't allow it to move. And these ones you wear at night sometimes, so it's a passive sort of appliance where it just goes over the teeth.
All right.
And what happens is if you don't wear it, there is a very high risk that your teeth will move back. So we don't want that happening. Yes.
Okay.
So yeah, I do see my patients throughout and also after they finish treatment to ensure their teeth remain in that position and do not move.
Right.
Yes.
And obviously when you talk about braces, it's quite tailor-made because why each of the what do you call these things?
So these are brackets.
Brackets, right? The
Yes.
brackets are stuck on your teeth and it's
Yes.
being aligned with a wire across. But when it comes to aligners, I assume that is being molded specifically to your mouth, to your set of teeth?
Yes, that's right. And there are also certain little bumps on this, if you notice, and these are called attachments. So they are little, we use it with actually a filling material where we place it over the teeth and it holds the teeth. It actually just allows the aligner to fit better and it also moves the teeth. So it's for tricky teeth that are a little bit stubborn. So when you have that on, it actually allows the teeth to move into a better position.
All right.
Yes, yeah. So, but you're right. Yeah, that's quite a stark difference between braces and aligners.
Yeah.
Yes.
But it must be weird, right? Wearing this on top of your teeth, going about your day. I mean, it does take that,
I think it does
that
feel,
period of time for you
a
to
bit
familiarize yourself with it,
comfortable.
getting used to it.
Both require adjustment, and I mean, some patients, prefer one over the other. I would say it's fairly comfortable to wear. You do feel a bit of pressure as the teeth are moving, but it's something that you adapt to very quickly, like you mentioned, So it's just about getting used to something, and in a couple of days, most patients get so used to it, and they're fairly easy to use as well. We have a video showing how aligners are placed, and so we'll probably show that to you in a bit as well.
All right.
Yeah.
Okay.
Yeah.
So, Doctor, actually earlier you mentioned about these advertisements that we see online, where there's just companies they promote all these Invisalign aligners and all that. I'm not sure if that's the right term, but they usually promote on that. So. There's a lot, actually. I come across a lot of advertisements. Scrolling on social media, we always see, it's something like about invisible braces, like in comparison with the old traditional style braces, the metal and ceramic braces, where they show like it's better and you can just get a dental kit, like how you mentioned, at a low cost and so on. And you mentioned that is not indeed recommended, especially if you have a more serious jaw or teeth problem.
Yes.
But we see a lot of that coming up often. How can we identify like which is like legit legitimate ones?
Yeah, that's a really good question as well. So Invisalign is actually a certified company that deals with this. And there are a few companies that are certified and they do it and it's proper. You see a professional, they'll go through the treatment with you, they'll show you a plan and then you go about with your treatment. And there are lots of other companies, like you mentioned, especially on social media these days, where they come about and they just tell you that, look, you know, I'll just send you a kit. You just take a mold and we'll fix your teeth for you. But it's very dangerous. It can be very detrimental to your health. I personally and a lot of my colleagues have actually seen patients come in with a lot more problems than when they started.
Wow.
So you're talking about receding gums, you're talking about bone loss, you're talking about even some patients losing their teeth because there were too much forces that were placed in the teeth when it shouldn't have been done in the first place.
Yeah.
So it's very sad because at the end of the day, patients have to see a professional.
Yep.
And that means additional charge, additional cost to them, but more importantly, long-term effects to the teeth and the gums and the bone. You only have one set of permanent teeth. That's it, you know. So you've got to look after it. You've got to actually go to the right people. So how do you know who is the right person? So basically, you need to seek a professional. So you need to look at going to see a proper dentist, an orthodontist. And all clinics in Malaysia, all dentists and all clinics, we need to, every year we need to renew our practicing certificate, our license. So you need to show that. So if a patient goes in, they can actually see that the doctor actually has an annual practicing license. That would be first. That would be a first thing to look out for. The second thing is you can always contact the Malaysian Dental Council. So we've got a council to protect patients, to protect dentists and clinics, to guide you as to which are the right treatment that you can choose
Sorry,
from.
Mayor, just not, I didn't mean to cut you off.
Yep.
Just wanted to ask one more thing related to my the previous question.
Yeah, sure.
So, talking about invisible aligners, I mean invisible braces, that's what we call aligners, right? Is it recommended for people who have serious problems with their teeth? Because we usually see videos online where it's just like, oh, you have a bit of a crooked teeth and the aligners can fix that. But is it recommended for like serious
Is it a miracle
problems?
worker?
Yeah, is it like
Nothing is a miracle worker, and it is just a tool. So at the end of the day, the person you choose to treat is the person who's going to plan your case and execute the case to make sure you get the final good result. So it's not a one fit approach, like one thing that will just magically work wonderfully. It actually depends on the person who's treating to be able to get the right treatment at the end, to get the right result, you know. So yes, you're right that it is more useful in terms of simple alignment. Today you can correct a lot more with aligners. You can even correct a bit more complex issues. But there are some cases where I say, no, this will be better with this type of brace. And there are some cases where I choose one over the other. So the right thing would be to seek a professional advice and they will be able to guide you as to what's best, you know, because you have no idea sometimes as to what's happening inside your bite and things like that, you know.
And very short answer from you that we would want is, cost-wise, which is better, aligners or braces, and how long do you need to actually wear them?
So, so with regards to cost, I would say there are many different products now with aligners. So clear aligners is a big group. So you've got many different brands that have it. And cost-wise, you can actually find different packages. I would say that initially when it began, in Malaysia, clear aligners are actually a bit more expensive than traditional braces. But right now with more companies coming up, and if your problem is a small problem and you just need a couple of aligners, then the price can be quite comparative. Yeah, so it really depends. A number of hours. So with fixed, the advantage with fixed braces, the advantage is that it just works continuously. You don't have to take it in and out.
So 2 years?
Yes, roughly about 2 years is a good guide. You know, with aligners, it well, actually, to be honest with you, it really depends. You can have short treatment with braces or aligners if your problem is a mild problem. But if it's a complex problem, it can extend till 2 years. You know, depending on the jaw, depending on the bite and things like that.
Yeah, depending on how you are. All right,
Yes,
so
that's
should you guys out there would want to get professional advice on what is more suitable for you, whether it's braces, whether it's aligners, you can actually meet up with our guest here, Dr. PRAVEEN GILL, orthodontist specialist from DentalRpo. Thank you so much, Doctor, for coming on to the show. Really appreciate it.
Thank you so much. It's my
something
pleasure.
that Irene would definitely consider in the future.
I would definitely consider. Suddenly.